Okay, good afternoon, everyone. I hope you all can hear me. So I am Dr. Chukwuma Obinna, a PGY1 psychiatry resident, and today we'll be doing one of our mental health munches series, proudly presented to you by Texas Tech Psychiatry. So today we'll be talking about a special topic, kind of addressing the Nigerian community in West Texas. And I was just looking at the participants to see if I could see familiar names. So I'm glad to be one of you. So I share. I feel I know what you feel, and I think I'm able to, you know, create the kind of awareness we need for mental health among Nigerians in West Texas. So today we are, talking about how we can strengthen our community, the Nigerian community in West Texas, by creating awareness, letting us know of the resources we have available for mental health in West Texas. So our outline kind of is just to create awareness. We are going to kind of recognize the different mental health conditions we have. I know for every one of us back home, what we know as mental health is just maybe that someone is going crazy or psychosis, but a whole lot more than that. So, and then we're also going to try to, clarify misconceptions surrounding mental health in our community, identify warning signs, and then highlight resources and the need to, act early. So why do we have to talk about mental health? So it is really important because mental health can happen to us. It can happen to anybody. It's not specific to any race or any geographical location. It can happen to us, hence we can talk about it. I know it's normal to say, oh, why talk about mental health is not common in our place, but we are in a new environment, we are in a new culture, and we have unique stressors which can tilt us into having mental illness. And then we also know that common in our environment is stigma, which has led to wide treatment gap. Hence, a lot of people actually do need this mental help, but they are not able to get it because of the stigmatization that goes with it. So, in essence, there are actually real consequences if we fail to pay attention and treat mental illnesses. So I'll start by trying to distinguish what it means, what mental health means, and what mental illness means. So mental health, it's kind of like a normal state that we are all in. It's a normal state of well-being, which involves our emotional, our psychological, our social functioning when it's on its kind of when it's at its normal level. It enables us to be able to cope with everyday stress, work productively, and then contribute to the society. And then on the other hand is mental illness. So, which is kind of a disturbance from this normal state. It affects our cognition, the way we think, it affects our emotion, our mood, and then our behavior. And then it's worth noting that mental health illness, it's usually both psychological, biological, and then it can also be due to developmental dysfunction. So that's why I said there are a lot of things that could cause mental health illness. I know, yeah, there are genetic undertones to it, but a reasonable amount of mental illnesses are just due to some stressors. So we, the Nigerian community here in America, cannot say it doesn't affect us. So we have to pay attention to it because the impact is huge. It comes with significant distress and functional impairment, hence the need for us to pay attention. So while I'm talking, if you have any question, just you can put it in the chat, you can note it. At the end of, we're going to have like 10 minutes where we can do question and answer if you have any question to ask. So, so mental health is kind of like a continuum. And if you look at the picture on the screen, we have the ideal state. The ideal state is where we all aim to be. That is where you have good mental health without mental illness. But sometimes we find ourselves, drifting into other boxes, like the those there are some who are struggling but coping. Those ones they have a very good mental state, but also they have a high mental illness, so they have more symptoms. So it's just like somebody has somebody's taking very good care of his mental health, but it doesn't remove the fact that he has a particular mental illness that he has and he's struggling with, but he's taking care of it. So in that case, he has not neglected it. He has symptoms, but he's taking care of it, maybe seeing his physicians, doing things to avoid stressors and doing other things that will treat him into having like moving into the critical state where you have severe mental illness, and then you also don't take good care of your mental health. So our goal should always be to make sure that we are in the ideal state where our mental health, that is our state of well-being, is high, and then our mental illness, that is the symptoms that comes with having a mental illness, is low. Okay, so that should be the state we should target. So why do we think that we have difference between physical health and mental health? It's basically because physical health is something that we already know. It's something that we are used to. There is no stigmatization attached to it. Hence, we tend to pay more attention to our physical health. Once we have any physical issues, we go see the doctor, and then we also, participate in some preventive activities to make sure we don't have a physical health breakdown. Maybe we get vaccines, we exercise, we eat healthy, but we do not pay much attention to our own mental health. So it is important to note that as we strive to maintain a physical health, we must also strive to maintain a healthy mental health. The reason why we treat it differently is that sometimes the status of mental health it's unrecognized or minimized. When we have an illness, we tend to say we don't have it. We don't want to talk about it. For our based on our culture and our religious undertone, we usually attach some religious explanations to it, saying that, oh, this is just a religious something, he needs prayer, we don't need to seek help. And generally we have noticed that we have like lowest treatment seeking rates for mental health illnesses versus physical health. So it's something we need to take note of. As we take care of our physical health, we also have to take care of our mental health, because really, mental health is that one that can even take us out faster than we think. Because a lot of people have lost their life to suicide, they've loved their life, they love their life to drug, they are not able to function in the society just because they have failed to take care of their mental health. Versus sometimes most physical health illnesses were able to, still survive and participate in the society. Now, I'm going to discuss the common mental health conditions. For most of us that grew up in Nigeria, we would, our, kind of conception about mental health is probably just the psychotic part of it. So when this person is no longer in touch with reality, maybe we think more of schizophrenia, and then another one that is common, we think more of bipolar. But the truth is that there are more than its mental health conditions, is more than that. We have the neurodevelopmental disorders, intellectual, which include intellectual disability, autism spectrum disorder. We're still going to talk a little bit about it. ADHD, specific learning disorders. The reason why I'm bringing this is if we do not know initially that these are mental health illnesses that need attention, then we have to now start paying attention to it. Maybe your child has been struggling with a specific thing in school, or maybe has some kind of delay, and we have kind of said, oh, it's this, or it's going to take time. Probably if you get the help you need, that child is going to do better. Okay. Another group of mental health illnesses I've already mentioned is the schizophrenia spectrum disorder, which the main one is schizophrenia. We are not going to go deep into explanation, but it's just still with psychosis. We have schizoaffective disorder. That's just psychosis and the mood. Brief psychotic disorder, delusional disorder. We also have the dissociative disorders, which is something like dissociative identity disorder, depersonalization, or derealization disorder. Sometimes people believe that maybe they are not real, or they believe they see themselves in another person. It has to do with those disorders. We have bipolar related disorder. There are different types of bipolar. It might be too much for us to go deep into it, but it's just to let us know that these are the mental health conditions that we have, and they are all manageable and treatable. The depressive disorder, the main one there is the major depressive disorder. For anxiety disorder, we have generalized anxiety disorder, we have panic disorder, social anxiety disorder. There are a lot of people, a lot of kids or people who are not able to, function well in a social setting. Maybe they are asked to give a presentation or to give a talk, even in their workplace. They are not just able to do that. But because they are Nigerians, they keep quiet about it. They don't want to talk about it. They don't want to seek help where they can, seek help and function better in their workplace. So these are mental health illnesses. Mental health illnesses is not just psychosis. Okay. We also have people with specific phobias. We have the obsessive compulsive related disorders. That's where you have the OCD, we have body dysmorphic disorder, we have hoarding disorder. Maybe you've seen someone who probably has hoarding disorder, but you don't know. There are people who are not able to throw away things. They have, when you come to their house, they have, they just feel like, oh, why should I throw this away? They have things over years to the extent that it is now kind of impairing their functioning, being a danger to themselves. And they feel like it's normal. I don't want to throw it away. But it's a disorder that needs treatment, that needs attention. You see, some kids feel like, oh, maybe my face should have been this way. Oh, why is my face this way? And you see them begin to seek treatments that are not realistic. Some even get to the extent of saying, I'm going to go to China to get this particular surgery. And we feel like, oh, is it normal? Or we feel like it's normal as a child. It's actually a mental disorder that needs to be treated. So as Nigerians, if you notice this, we're bringing it up so we know that these are mental disorders that need treatment, so you can seek treatment. We also have the somatic symptom disorder, illness, anxiety disorder, conversion disorder. Another one, which we also probably have seen people who have it, is like anorexia. Um, they don't just want to eat, or bulimia, those who induce vomiting, or you see those who, just they have eating disorders. People who eat, and then induce vomiting. They eat like at a particular time, they binge eat, all of a sudden they induce vomiting. All these are mental health disorders that are treatable. We also have the sleep disorders, insomnia, and a good number of people are not able to sleep, but they are not seeking help for it. It continues to, bother them, and then get worse, cause more problem for them. Then substance related and addictive disorders. We have those who use alcohol, cannabis. These are real issues. Some people just keep using it, thinking they're using it to cope, or they use more and more just to cope. But it's actually a big issue. But if you don't know that there are resources to help you quit, to help you stop, you'll probably not even seek help in the first place. So, in our goal is to create awareness. We can talk about all of them, but we're also just gonna, pick a few of them and talk about like the most common ones. So, if you get any signal or any sign, you can just quickly, get help. So, for immigrant community, the stressors on the family, it's a little bit different for those who are not immigrants, because in addition to them having some stressors which causes them to come down with mental health illnesses, we have a whole lot more because we are in a new environment. So, whenever you arrive in America, you're already taking pictures, sending to those at home, telling them, oh, I'm in America, I can make it, I can do this. But then the real stressors are still there. You have to face with adapting to a new culture. You have to face the fact that, oh, you might not be able to talk to your neighbor for 1 year, unlike the way you would do back home. Okay. You might now have to start facing the new financial pressure. Maybe you probably were able to pay the amount you're using to pay your monthly rent right now would be enough for you to pay your 2 years rent in Nigeria. Or you're making the money, but you're spending it every month. So that's the new reality. For a lot of people who just came, it's very stressful for them, causing anxiety, causing a lot of mental health issues. So, but this is the new reality, and we need to take note of this. There are systemic issues. We're still going to talk about these systemic issues, racism, discrimination. All these things could, increase our mental kind of illness or breakdown. Also, role shift. I know some families back home, the man is the head of the family. He takes decision. He mentions what happened. But when you come over here, it's totally different ball game. There are some men who have had mental breakdown because they feel like they are not able to, assume that role of being the leader of the family, or they'll feel like, oh, their friends are saying that they are not in charge of their family because they are in a different. But we need to understand that we are in a different terrain and things work a little bit different here. Okay. So for adults and children, it's different. For adults, we need to face the fact that um, we're going to have work stress, we're going to have job instability. There are some people who are doing well at home, but oh, because they want to come to America, they are here, they're not able to do the exact thing they want. It's causing a lot of stress and distress to them. There are families who wouldn't have mental issues right now because if they are at home, they would have gotten a lot of help with taking care of their children, their newborn. But here, you're not able to get that. So these are real stressors. Some are here and they are not able to meet up the expectation, the things that they are thinking of, that, oh, if I come to America, I should be able to do this or do that. They're not able to get that expectation. And some loneliness, like I mentioned, you were able to talk to your friends before while you were at home, but here you're living in an apartment, you're living in a house, you don't know who is your neighbor, you can't even talk. These are like, triggers or risk factors that can trick us into mental health illness. For kids, it's they face like school and academic pressure, identity conflicts, parent-child cultural gap. So for identity conflict, you're here in America, you have a child. The child was born here, but the child has to deal with the fact that the parents are not Nigerians. So the parents are not born here, so the parents are Nigerians, so they still have their Nigerian culture. So you can imagine your 3-year-old boy shouting, "Daddy, come here, please." You know, your first response will be like, you dare not order me to come here. But you also have to understand the fact that the child is currently now in another environment. And in this environment, it might be normal, but where we come from, we don't expect the child to do that. So these are real stressors, both for the parents that the child is saying that is addressing him in that way. And for the child also, it's a stressor for the child because the child is wondering, oh, why is my daddy overreacting? Other kids do that. So these are real stressors because if he continues, the child begins to feel down. Mhm. And then we also have like I also explained, the parent cultural gap that is there. Key peer pressure and bullying for kids, difficulty expressing their emotions, all these could, heighten their mental breakdown. So just to dispel some misconceptions about mental illness, I know we think it means just madness, but it's actually not just madness. There are a spectrum of mental illnesses, depression, anxiety, trauma. All these could cause a mental breakdown. So we can also assume that, oh, because I'm a Nigerian, that's not for me. Um, Depression cannot be my portion. I cannot be affected by depression. Oh, it's not a Nigerian thing. It's the rich man thing. That's not actually true because there are a lot of research have shown that there are a lot of Nigerians and African immigrants who are, facing the same chronic stress, discrimination, isolation, and they are severely depressed, but they are kind of hiding it. And then because we always add the religious undertone, we always say that, oh, that whoever has a mental illness is cursed, or it's only prayer alone that can help it. There's a lot of them. I just brought out these few, but most of those things we think about mental illness, it's actually not correct. Mental illness is not a cause. Someone who is psychotic, it doesn't mean that the person was caused, and it doesn't. And it's not only prayer. Prayer can help both with physical or and mental illness, but it doesn't mean that going to like going to prayer houses is the only option, which is a big issue because there are many Nigerians who actually need mental help, but they are not able to get the help they need because they assume that it is a spiritual thing and they do not need to see a psychiatrist or they do not need to see a therapist or to get help. So it's also not only extreme trauma that causes mental illness. Mhm. So I'll be a little bit fast. So now let's go to recognizing the core signals of or the core signs of mental health. Um, so for adults, I'm still going to discuss it in detail, but just to summarize generally, the core signs for mental health illness could be persistent sadness, anxiety, irritability, sleep problem. You should just discover that this particular family or friends suddenly withdraw from everybody, withdraw from church. These are signs that someone is going through a lot, but you're no longer seeing the person, or someone has kind of declining work performance, someone who used to be very good, very efficient, suddenly no longer able to do that. You can tell that something is going on. For children and adolescents, it can usually present with declining grade. They start avoiding school, complain about school, they start withdrawing from things that they usually enjoy. So as parents, we must, take notes and, observe these subtle signs, subtle warning signs in our children before it gets out of hand, but we need to pay attention. So now we're just going to go deep and talk about, some common mental health illnesses and the way they present and, the way they can also present culturally, like maybe in the Nigerian environment. So one very common one, both in adults and then also in children, is it's depression. It's very common. So you begin to see the person's mood changes. Person is persistently sad, has low mood. It could present as the person just being irritable, just being unnecessarily frustrated. You can see like the person has short temper. So the main thing you look out for in depression is you look at the person's mood and then you look at, kind of interest. So does this person still enjoy the things he used to do? It could be someone who is no longer enjoying the things he used to do. It points you towards, oh, this person is depressed. This person stop attending church, stop attending social event. It's pointing towards something that this person need help. They have like low energy. They are not motivated. They are just tired, always tired, or they can have sleep issues. Either they are not able to sleep or they are sleeping so much. They can also have appetite issue. It could be increased or decreased. They can also have weight changes. So also, clinical features of depression include poor concentration. The things they are doing well, they start, kind of getting errors. They have work errors, they have academic decline. Of course, you can't really do well with your work or academic issues. You're not able to concentrate. So, which is a core feature of depression. Another one is guilt, or they start feeling worthless, which is really common here. Sometimes parents, Nigerian parents, trying to raise kids in this environment, they feel very, very overwhelmed. They start feeling guilt. They start feeling like they have failed. They are not good parents. They have not been able to raise their children in the way they wanted, or they feel like they would have done it better if they were back home. So these are core signs of depression, then suicidal thoughts, feeling like the world will be better without you. So we need to watch for these signs amongst ourselves, our family, our community. You can even tell someone, I feel like you need help, because some people need help. They're not able to talk about it. You can direct them and tell them, maybe you need help, maybe you need to talk to someone, talk to a therapist. Okay, I'll be a little bit faster because we don't have time again. So, the other one is anxiety. Okay, so sometimes it comes like excessive uncontrollable worry. You're just worrying about everything. You're worrying about the family, but the family here, but the family home. That is another thing that increases our level of anxiety, leading to a mental breakdown. Sometimes we have to worry not just about ourselves here, we also have to worry about those whom, everybody at home think, oh, you're in America, you've made it, they are calling you, they want this, they want that, but they do not also know that, there are a lot of things that you have to take care of. You have the bills to pay here monthly, but maybe back home, they pay it yearly. So we have to kind of reduce that to keep our level of anxiety low. Anxiety could also present as like maybe muscle tensions. You're having restlessness, difficulty falling or staying asleep. You're having racing thoughts. You get easily annoyed or reactive, difficulty focusing. If you are having these symptoms, it is not normal, especially if it is impairing your daily function. So don't assume, oh, I'm bigger than it, I'm stronger than it, I can manage it. It can weigh you down. So just make sure you seek help. Okay? Now here comes the main one we know, the main one we assume that has to do with mental health psychosis. It's just kind of getting losing touch with reality. very common in schizophrenia. It's also common in mood disorders like depression, bipolar, but it's the core feature in schizophrenia. So you see, people start hearing voices. So it's not like the voices are in their mind; they are hearing voices of people who you cannot see, or they are seeing things, they are communicating with people, or people are telling them what to do. Someone is telling them, go do this, go kill this person, kill yourself, do that. These are real mental health issues. And something I'll keep mentioning throughout this presentation is that they are actual issues, they are actual deviation from the norm. It could be like it could be maybe due to genetic or environmental factors, but these are real deviations. These are not causes. It doesn't mean that person has been caused. It doesn't mean that person has a spiritual problem. Okay, so it's something we need to pay attention to, because this is usually the basis for the stigmatization that comes with mental health issue. We think the person has been caused. That's why he's hearing voices that other people cannot hear. They're having disorganized speech. So a lot of things could cause it. Sometimes some people just receive a bad news and they're not able to adapt to it. They suddenly start hallucinating, something they've never had before. It can actually happen to anyone, so we have to pay attention. If we have it or know anyone having it, then that person needs to seek help. Mhm. So, when you need to seek help is when there is threats to self, like to harm self or to harm others, severe agitation, or just feeling suspicious of everything. Someone suddenly start telling you that, oh, the TV here, somebody in the TV wants to hurt me. That person definitely has a disorder, and it's actually not your role to make a diagnosis. That's why we are creating the awareness. If you start noticing any of this, just present, and then we make the diagnosis and know how to help you. So it's not your role to say, I don't think this person has depression. It's left for us to decide. So make sure you seek for help, and then we can tell you it's not depression or it's depression. Okay. So the other mental health issue, which so many people don't think it's a mental issue, it's a big mental issue, is substance use, which is very, very common in our society. Alcohol use, marijuana, cocaine. People, use this to the extent that they begin to have they are moving from just taking it to being dependent on it. They cannot do without it. If they ever try to have it, they have, very, very, severe anxiety about stopping it, or very bad withdrawals about stopping it. So whenever you start noticing that, oh, you're beginning to have increased use of a particular substance, you know, you are unable to control yourself, despite trying to cut down, you just keep using it. Or, you used to take one bottle of alcohol maybe in a day, and suddenly you need to start taking two to be able to feel good. Then you gradually begin to have like substance use disorder. Or whenever you stop it, you have very bad withdrawal symptoms. You're having this strong craving, continuous use when this thing is obviously causing harm and then impairing your social functioning. You need to seek help in the first place, and that is why we, as Nigerian parents, in America, we have to pay attention to the kind of interactions our kids have. Who are they mingling with? Because sometimes we are so engrossed with work and the things we have to do to survive that by the time we realize that our kids are already testing marijuana, they have gotten to, they have gotten to the point of dependency, and then it's very difficult for you to ask them to stop. So we need to pay attention. Okay, in addition to working, we need to pay attention. So for children, we also need to note the core conditions in children. They have anxiety, how they present for Nigerian family, you need to, if a child has anxiety, it could present as maybe refusing to go to school, just telling you that they have stomach ache before school. That could be, another means that anxiety is presenting. For depression, it could be bad attitude. They are just isolating, excessive sleep. ADHD could come up as maybe the child struggling academically, or you just blame it on being lazy. For trauma, that's post-traumatic stress disorder. They just become fearful, irritable, and can have like an emotional shutdown. So we have to pay attention to these mental health conditions, and then be ready to pick the warning signs in case if we see it in our children. Um, the other important mental health condition that is worth mentioning, especially for the child and adolescent population, is ADHD. Um, Maybe you haven't heard about it at home. It's not common. Maybe you call it stubbornness at home, but it's real here, and it impairs children's performance. So I know we have like we don't want to label our children as having ADD, but we also need to pay attention to see, do they really need help? Do you think the African way of handling it is really going to handle it? Because sometimes they present as inattention. They are easily distracted. They forget, they lose things. It might just be ADHD. Sometimes they are impulsive. They interrupt, blot out answers, or they are hyperactive, constantly moving and fidgeting, struggling academically. So sometimes we say they are too playful. It might not be that they are too playful. It's just like an underlying disorder that needs to be taken care of. You can see them as being disrespectful. They are not doing it intentionally to be disrespectful. It is because they have a disorder. That's what it means. So we need to pay attention to this. It's a neurodevelopmental disorder. Another one we also need to pay attention for the Nigerian families here. Like I said initially, why we have to talk about this, it can affect you, it can affect anyone. Do not see that it cannot affect you. It can happen to anybody. Another one is also this autism spectrum disorder. You start noticing a child, they're having limited eye contacts. They have like their social communication is really poor. They have difficulty, having a conversation. They have very poor social interaction. They prefer to play alone, difficulty reading social cues, or sometimes they overreact to things that they shouldn't overreact to, like to light, to noise, touch, textures. Or you find some of them, they just prefer routine. If you give them Cheerios in the morning, you have to give them Cheerios every morning. You can't give them any other thing. If you give them any other thing, they have this intense anxiety. So if you do not know, and some they also have language and delayed speech patterns. So if you do not know that this is an illness, you'll probably think, oh, my child is different, and then the child is not able to get help. But there's a lot of children who, been diagnosed with autism spectrum disorder, and they've gotten the help they need, and they are doing better. But if you don't start on time, or I've seen parents who would, oh, what is going on? Then the grandparent at home will be like, can you send him back to Nigeria? Let's take care of him there. Even if he goes there, it's still not going to change. It is because we have failed to recognize that there is a mental health disorder that needs help. At the moment we recognize it, then we can get the help we need. Okay. So just like a recap, the stressors for Nigerian youths, identity conflicts, if they are African, if they are American, they have this confusion, low esteem. It's left for you to make sure you talk to them and tell them, being an African does not make you less human. If you don't tell them, sometimes they feel that way because they come into a class and they are the only black person, everybody is white. They naturally develop this low self-esteem. Gradually, they are not able to perform, they are not able to do anything. So we need to let them know that it is not a crime to be African, it's not a crime to be black, and then you can also achieve whatever you want to achieve. And then we also need to take note of the parent-child cultural gap. Both you as a parent, you need to take note of that so that you know how you talk to your child, understand that there is a gap between what you know, your culture, and what the child has been exposed to. That's why from time to time, if you can make sure you teach your children where you come from, it's going to help with that gap. If you also can take them home, let them know where they also come from. Okay. Academic pressure, I've talked about it. Racism, bullying. Let's move 40. So the red flags we need to take note of. Please do take note of these red flags. Once you have any of these red flags, or you see anybody having any of these red flags, then that person needs to seek urgent care. So if there's any form of suicidal ideation, someone is talking about death, feeling hopeless, beginning to give away their possession, you need to act fast. If there's threats to others, you need to act fast. Psychotic symptoms, or you find someone who is just unable to take care of themselves, they are in the same room, not able to eat, pooing and peeing in the same room, then that person is actually mentally ill and would need very urgent care. So if there is trauma or safety issues, then we have to seek help immediately. So, what are the barriers, between the US and care? So, what are the things that are preventing care? So, we just need to take note of these, because sometimes it's there, but we don't even know it's there. So, it's the first part is like ideology and belief. Many of us have like very limited mental health literacy. We don't even know about it. So, how do we seek help if we don't know about it? Then course, the main thing that I've talked about several times here is cultural belief, framing it as spiritual illness or moral weakness, and reliance on prayer and healing alone, then misunderstanding of symptoms. So sometimes we're having real mental health issues and we just, I have a headache, it's going to go, let me sleep and wake up. But it's still there. Still, stigma is still a big thing. It's one of the main thing really preventing care from happening among the Nigerian community, because nobody wants to see, oh, I saw you the other day taking your child to Oceans, or I saw you the other day taking your child to Texas Tech. It doesn't really matter. It's just like somebody saying, I saw you the other day taking your child to the pediatrician. Do you feel bad if someone say, I saw you taking your child to the pediatrician? We should also not feel bad if someone say, I saw you taking your child to the psychiatrist. You need help. If you have to, allow stigmatization to be a barrier between you and care, then you probably end up suffering more. So Nigerians in West Texas, we need to get up and take our mental health very serious, breaking these barriers. The other barriers, some we can help, some we can't help, but some other barriers to care, like structural and financial. Some of us do not have the money, we cannot pay for the insurance. And then sometimes the long waiting time to get in. Then also cultural language and cultural barriers. Some of us are not able to maybe clearly speak English. And then that's why I also mentioned sometimes when we go home, it might not really be the best thing for us to go get our parents at home and bring them here to stay for long, because sometimes they have these severe mental issues, but they are not able to really express themselves to tell you this is what is going on, for us to even know that they need help, because they come here, they are isolated, they're not able to express themselves and all that. And so now also immigration status can also be, some people are not able to access health because they feel like, oh, maybe their immigration status is not. So these are barriers preventing us from getting care. So we need to know them, see how to solve them to be able to get the care we need. So now navigating, what does mental health look like in the US? I'll be really fast now. So you start with your primary care doctor. I don't know how many of us Nigerians know that we are supposed to have our primary care doctor. If you haven't established care with your primary care, please do that. You can talk to your primary care physician about any mental health illness, and then you can also call because somehow, technically, I would also say that psychiatry, even if it is specialty, in a way, it's primary care. So if you have any of these mental health illness, feel free to also call up the psychiatric clinic to set up care. Then we also have specialty. We also have like special services like the outpatient clinic, private practices. We have therapies, and we also we also have like community-based services, like faith-based program and social services like the nursing homes, rehabilitation centers for drug and all that. And we also have emergency and inpatient units. This is especially for those, with, very, very, or who are having a crisis. You need to take them to the emergency or take them to the inpatient unit for stabilization. So there are gamut of, services depending on the kind of mental health illness you have, if you need therapy, if you need counseling. And then we're also going to talk about those resources briefly. So the treatment options for the different mental health illnesses, it could be psychotherapy. I've talked about it. It could be individual. You can treat the individual. You can treat as a group, as family, and the main one, they are different type of psychotherapies. But the main one that is usually very common is a CBT. We can also have like medication management. Okay. So treatment option is medication management. Most mental health issues have different medications that you can use to, kind of control these symptoms. It might not really take them away, but it helps to control them. So it's really better than not doing anything. So just make sure you are aware of this treatment. There are some advanced treatment management. Maybe I don't even know. It's going to be controversial to some people because some people will be like, oh, why are we giving them a shock and all that? But most of these treatments, they have been tested, and even in physical medicine, all kind of treatments we give come with adverse effects. Okay? So it's same like ECT. A lot of people have different ideologies. Why should we shock the brain and all that? But the adverse effects the side effects have been studied, and the benefit is much more than the side effect. If the side effects were much, it would probably not be. Like if the side effect was more than the benefit, we'll probably not be doing it. So there are some advanced treatment, and most of these options we have it here in West Texas. We have TMS clinic, we have ketamine clinic. Also, we do not have so much time to explain all of them. But just know we have these treatment options for us in West Texas here. If you also want telehealth services, we have telehealth services. So all these treatment options are available. So just be ready to make use of them. So how do we address these barriers or these issues? The first one is that we have to make use of the people we already trust, our community leaders, our leaders in our place of worship. We have to start reducing the stigma, because the main issue for us, the Nigerian community, is that a large percentage of us still think that mental health issue has spiritual undertone. Okay, and that's why if we have leaders here, religious leaders listening to us, the work has to start from you to begin to let people know that that you can pray, but as well you can still receive the mental health treatment you need. If we can get past that, then we're going to have a lot of people receive the care they need. Not to say that prayer is not working, but we need to do it hand in hand. Okay, and then also in our different subgroups and communities, our leaders should be able to normalize talking about mental health issues. Okay? So, like I mentioned, culture, faith, and medicine, they can all work together. Okay? So, also, like I said, prevention starts from home. From my experience so far, I would say that especially in the child and adolescents population, majority of the mental health issue usually start with a destabilized home. A destabilized home. It's not part of our culture to, to break up easily or to, have homes with a lot of stressors that are destabilizing us. But being in this community, being in a different community where you have to, some of us have to work extra hard. Some of us do the kind of roles in which we do, the husband is doing day and the wife is doing night. So it's just like the husband is practically waiting for the wife to come back. So he can hand over the kids to the wife and then he goes for his own work. We keep doing that day in, day out, and before a period of 5 years, you discover that your home is shattered. You do not have time for your kids. Your kids are probably watching YouTube, they are on the internet, so you have not had time. So we need a stable home. Okay. Now, you also don't need to be isolated because America is already kind of factored. Everyone is on their own. You don't have neighbors talking to each other like you do at home. So we have to make sure we find things that keep us connected. If it's going to church, if it is like community activities. I know in West Texas here we have the West Texas group we have the WhatsApp group for Nigerians in West Texas, and I know they have the annual events. There are different activities going on. Just make sure that you're not on your own. Make sure you get in touch with people, belong to the community, and make sure you seek help. As soon as you begin to notice any of these symptoms. So I'm moving fast now just to round up so we can ask questions if we have any question. So just know that we don't need to be ashamed of getting mental help, just like you're not ashamed if you have malaria, you just walk into the clinic and get help. If you have any mental breakdown, no need to be ashamed and go and get the help. Now, we need to learn to start on time because if you delay, it might get to crisis points, or you might have like irreversible, adverse effect for not seeking help on time. A lot of people have committed suicide. It was because they did not seek help on time. Okay. So I'll be fast. So part of the things we can do, excuse me, part of the things we can do, rest, play, travel, take your children for camping, go for outing as much as you can. Do not keep your aged parents for here for long. Because it might not be the best place for them, then just be proactive. So, sorry, resources we have in West Texas. These are the resources we have in West Texas. We can have this slide after that was, but you have resources if you have any crisis or emergency. You can always call the suicide line. We have the primary care, it's 24 hours crisis line. You can call them. You can call any emergency, whether Midland Memorial. You can call the police departments. They always have like a mental health deputies. Call them. And then there are resources that are also free and low cost. Maybe at the end, if you have this slide, you can always look at them. For the VE, we have something for you. We have community support. We have things for families and people who are parenting. We have a lot for youth in West Texas here. We have counseling services. We have list of psychiatrists in West Texas, and then we have Texas Tech, so you can always come to us for inpatient and intensive care. We have the Big Spring State Hospital. We have Oceans between Midland and Odessa. We have Oceans in Abilene. We have Scenic Mountain. We have Rivercrest. So all these resources are available to us. Just make sure you make use of them. And then finally, we have something big coming up, which should serve Permian Basin and then West Texas. at West Texas at large, the Benny Basin Behavioral Health Center, which will be kicking off sometimes in the middle of this year. It's we are going to be the one coordinating it. So it's in Midland, Odessa here, very close. So you do not have any reason not to seek mental health. It's a 200 bed hospital. Just mental health hospital is going to serve us in all capacity, counseling, inpatient, outpatient, forensic, elderly, child. We're going to get all that we want from this hospital that we are looking at that is coming up soon. So I just want to talk to I don't know how many Nigerians are here, but the Nigerians in West Texas just know that mental health is real key, and then we have to be able to have a balance between our beliefs at home, our culture, our faith, and then mental and these mental health conditions, and we should be able to seek help when we need help. Thank you very much. I think I have just 5 minutes. I don't know if anyone has any question to ask. Do we have any question?
Doctor, we have a question in chat.
Okay, let me check the chat. Okay, so I think this is the question, right? For someone worried about confidentiality, what assurance can we offer them about seeking care? Okay, so mental health illness, it's a little bit unique compared to physical illness. And one thing you have to know in terms of confidentiality, there is nothing you are discussing with your psychiatrist or you're discussing with your therapist or you're discussing with your counselor that goes out of that counseling session. Okay, not even another physician, not even another psychiatrist is able to see it. So nobody discusses a situation with you with even another Nigerian. Okay, so but this question still this question still goes down to the fact that we need to understand that you know, mental health, we need to kind of eliminate that stigmatization. Because the reason why we maybe wouldn't really care if we have a heart attack and we're in the hospital and we don't really mind if another person knows is because there is no much stigmatization attached to it. But in mental kids, it's in mental health, they like that's not the case. People feel like if you have a mental health illness, then that's the end of the world for you. That's not the case. So let's start with that fact. Having a mental health illness, having a mental breakdown doesn't mean that or you are doomed. It doesn't mean that that's the end of the world. But be rest assured that whatever you're discussing with with your psychiatrist does not go out of that interview room, does not go out of that. Not even another physician can read the notes. So everything is confidential. The management is it's between you and your psychiatrist. We might have to tell another person, for instance, if I have to transfer you or care to another physician, then with your permission, I have to tell the physician, okay, this is the level of care so far. The next physician has to continue. But in terms of confidentiality, it's very confidential. So no one is going to know what kind of care is going on, or unless whomever you choose to let know, to tell. Yeah, you can unmute and ask a question if you want to ask. So while it's 1 o'clock, if you have any other question, you can just reach out to Texas Tech directly. Just reach out to the email pbpsychadmin, and then I would, if once the question, I would reply the question and get back to you through whatever means that you asked the question. Okay. Thank you very much for joining us today.